Cosmetic surgery is big business in South Florida. So coming up next, I talked with one of the area's top plastic surgeons, Dr. Luis Vinas. And in an interview taped earlier, I asked Dr. Vinas what his latest innovations was in his practice.
There are a few new things that just come out in the last few years. One of the most important that I've seen is called Ulthera. Ultherapy is a new way to actually shrink the skin with no downtime.
Wow.
It's a device, it's ultrasound that goes right through your skin. As you know, ultrasound doesn't hurt your skin.
Right.
But then the technology actually was made so when it goes onto the skin, it actually focuses in a small point. And that causes a small danger or a small injury that then creates collagen, and the collagen makes it tighter. So the technologies are unbelievable. So now patients are coming, for example, after a facelift, and they can do maintenance once a year, and they prevent the next facelift. So now they can keep looking young.
That's right. Well, doctor, you know, during the recession, you know, that your business is discretionary income.
Right.
How did you cope with the recession? You know, did you make it through okay? Obviously, I hope so.
Yeah, we did well, but it did go down. We did see 15–20% decrease in patients coming in.
Right.
Thanks to my patients and the family members and their, you know,
you
friends.
got a lot of referrals, right?
Yeah, most of my referrals are from family and friends of other patients. So a happy patient always brings you another 10 patients. So, so that keeps going. And thanks to that, you know, we made it through and we're doing fine.
All right. Hey, listen, speaking of patients, do you find more guys are coming in for procedures rather than in the past?
Oh, yes, they are. And nowadays, you know, men want to look good. You know, and you see a man that walks in and he looks good, in great shape, but he has a little bit of fat on the side. So I want to remove this and make it perfect. So they're starting to look at more perfection like women were looking before, or men that come in for a little bit of an excess in their neck.
Like the neck like I got. Yeah,
that's something we can fix.
Neck, right,
make it look really good.
You can handle this, can't you? You can
that's
take
right.
It,
we can do that.
You know, another thing, the lifestyle lift marketing that's going on now, that they're spending a ton of money with the Debbie Boone spot, you know, about getting a facelift. So, well, how does that work when you call in and respond to the direct marketing?
Well, I see patients that mention lifestyle lifts. Patients come to see me for a facelift, and they all see the advertising, and a lot of patients do ask me about that. I'm not part of lifestyle lifts, so I don't know the intricate details of how they do things, but I know the marketing works. It's getting to the masses. And what I understand is that everything is done under local anesthetic. It's not anything special in their surgery. You know, you have a surgeon that is doing the procedure, but you're not getting a person that is trained for so many years and with the experience that for example, I have. Yeah. You know, you may get somebody who just came into practice 5–6 months ago.
You don't even know the guy, right, until you come up maybe a day before?
You really don't. You know, patients go to lifestyle level, they're going for a business. They're going for the name. And then they meet a doctor the day or two before the procedure. So this is something that you get to know the doctor after you walk into the office. And the results depend on the actual surgeon doing the procedure. So I think patients should be doing their homework and going to a doctor with the expertise that deserves this type of procedures, and make sure that you educate yourself. Make sure that you know exactly what type of procedure you're getting and how it's done. Otherwise, it may not be longer lasting, or maybe these scars may be in the wrong place. You know, you need to understand those details.
You're walking around 3 or 4 weeks with a bandage under.
Right. You know, I try to explain to my patients exactly how it's done and what the outcome is going to be, the inflammation time, the swelling time, and usually swelling goes away very quickly with the techniques I use. So it's worthwhile. You know, you can go back to work within a week, or seven days later, you can go back to work.
And everybody's giving you the wow reviews, right? Well, no, you're chief of plastic surgery at Good Sam Hospital. You know, that's pretty terrific.
That's correct.
Where are you from?
I was born in Puerto Rico, San Juan.
Then you trained in U.S., of course, right?
Right, yeah. I trained in, I went to college in UMass, and then went back to Puerto Rico for medical school. But then I went back to Long Island, New York, and I trained in surgery, plastic surgery. I even did a burn fellowship while I was there before plastic surgery.
Wow.
So
that's terrific,
well trained.
Yeah. All right, one last question before we wrap it up. all the plastic surgeons I know say, stay out of the sun, you know. And I'm not going to stay out of the sun, and guys like me are not going to do that. What's the best way to protect from sun damage if jerks like me don't follow your instructions?
If you're out there playing golf or tennis or walking around, you should use sunblock every day. You know, the worst cause of sun damage in your skin, it's like the problem is that the sun causes damage to your collagen. So if you're exposed every day and you have collagen damage, you're going to look older than you really are. So just by preventing the sun, you know, you're preventing aging. So it's like the best anti-aging thing you can do. Sunblock and a good moisturizer. You know?
Right. Oh, listen, God bless you, doctor. Thanks a lot for being here.
Thank you.
Yeah,
appreciate it.
And stay with us. We'll